Morning. We're going to start as we always do with recognizing, again, I always recognize our healthcare providers, everyone on the front line. A few weeks ago, I mentioned our EVS folks and a significant part they've played in getting us now to this point where in our primary discussion is about our pivoting approach, our approach with reopening, getting back to the new normal. And again, I want to take some time to just commend these folks. Our EVS group has been significantly pivotal in getting us to this point. I'll move on with discussing the current numbers at Hartford Healthcare in regards to COVID positive in our PUI patients. So currently within the system, there's 122 positive COVID patients with 272 PUIs. And just for pure definition, so the PUI patients are patients that we're ruling out, we're working up in our acute care phase. And how it breaks down per entity, so Bacchus Hospital has 1 positive COVID patients and 35 PUIs. Charlotte Hungerford with 1 as well, positive patient and 69 PUIs. Hartford Hospital has 21 positive patients and 98 PUIs. Midstate Medical Center has a total of 2 positives and 18 PUIs. St. Vincent's Medical Center has 12 positives and 6 PUIs. Hospital of Central Connecticut with 8 positives and 31 PUIs. And Wyndham Hospital with 3 positives and 21 PUIs. So those are acute care space, and so total for acute care space is 48 positives and 269 PUIs. And again, for behavioral health network, there's no positives or PUIs at this point. For community health network, there's 74 positives. And again, just for identification, those 74 positive represent patients that have gone through our acute care phase and are recovering and are doing quite well, hence the reason they're within the community with a proper social isolation, social distancing, and proper treatment in a continuum of care with Hartford Healthcare. Where numbers are concerned, a few days ago I had the opportunity to look at April 22nd. April 22nd, we had 425 cases in Hartford Healthcare. That's a significant difference from in our acute care space right now. We have a total of 48. And as I said before, we're now at this point that we're discussing reopening. We're asking to keep vigilance on social distancing, universal masking, and infection prevention practices such as hand hygiene. A few things, so visitor restriction policy, this is something we've discussed a few times. We're doing a phased approach. There's a lot of initiatives and effort that's gone into ensuring that this is a safe and diligent process. It's been greeted very well by our patients and our visitors, and it's been greeted very well as well by our staff and colleagues. So a phased approach visitor restriction policy with the hope that within a few weeks we'll get back to where we were some months ago. So in regards to essential surgeries, so essential surgeries are back in process. There is a few initiatives or processes that are put in place to ensure that this is a safe transition, including pre-op testing and pre-op screening. The patients that we've spoken to since we've opened this process have expressed feeling very safe through this process, and we've had very good success with patient recovering and doing quite well. Hospital safety in general, again, I can't stress enough, we can put as much protocols in place within the hospital setting, but I ask the community to be vigilant. I know we've gone through a very rough patch, but the disease process is still there, the virus is still out there, so be vigilant with your infection prevention practices. Again, the reason why we're in this position and we've turned a significant corner and we're seeing this significant downturn, which is really good, is not just the effort from a hospital or healthcare perspective in Connecticut, but also the effort of the citizens of Connecticut. We've done well in trying to get the information out to the populace, and I think the Connecticut citizens have done very, very well in using that information to reduce the actual impact in the community. And I will continue to applaud, but I will also say just be vigilant. The numbers are good, but the disease process is still out there within the community. Updates on COVID, as I said before, we are experiencing significant decrease in numbers. We've increased our testing capacity. We've increased our testing sites availability, and we've decreased the restriction, for lack of a better term, to actually get a test. So the criteria for receiving testing has been loosened quite significantly, and we've also expanded our capability for testing. And going forward, what can we expect? So I think the numbers will continue to go down. The rate of change is going to decrease, I think, exponentially. But the numbers, I believe the numbers will continue to go down, and we'll continue to get to a point when we could get back to what, I don't want to say what normal or what we had before. I don't think we'll ever get back to that point for a very long time. But at this point, we'll be able to get back to a more functional process, so a more normal functional process. So at this time, I want to introduce Dr. Rocco Orlando. Dr. Orlando is the Chief of Academic Affairs at Hartford Healthcare, someone that I have a significant amount of respect for, someone that behind the scene has played a significant role in developing processes to get us prepared for responding to this disease process, and also been pivotal in getting us to the point when we can discuss, have these discussions about moving into a very, very good direction and getting back to the new normal. Dr. Orlando.
Keith, thanks very much. So what I wanted to focus my comments on this morning is on the academic enterprise at Hartford Healthcare and how we've really channeled that to respond to the coronavirus crisis. As the Chief Academic Officer, I'm responsible for our research portfolio, and with the onset of the crisis, and as an organization with a long history of doing research, we immediately focused our efforts on seeing what we could do to learn as much as we could about the novel coronavirus, what we could do to evaluate treatment, what we could do to identify risks. And so we really immediately pivoted and created a leadership group in our research organization to really focus specifically on coronavirus. A number of steps that we took. First thing that we did was that, leveraging our large investment in the electronic health record and in data, we created a database so that questions about the COVID-19 disease process could be queried, could be analyzed to provide our clinicians and our researchers with information. We sought out partnerships with the pharmaceutical industry and actually have a number of clinical trials underway with a number of promising treatments for COVID-19, and so these are underway. We participated in the Mayo Clinic-sponsored convalescent serum program, where the plasma from folks who had suffered from coronavirus are being used to hopefully improve the course of the disease. So many therapeutic and diagnostic efforts. We have undertaken an antibody testing to really learn what is the prevalence in our healthcare workers at Hartford Healthcare of the COVID-19 disease. How many folks have developed antibody? We deepened our partnership with MIT as a result of this, both on the analytic front, really looking at data, looking at risk factors that would identify patients who were at risk for severe complications or death of COVID. And we're also working with the MIT team to create a new and we hope simpler way to make the diagnosis of COVID-19 using some different kind of technology than what has generally been applied. So we've been very active on this front, really using all of our assets to be look as broadly as we can to identify what we've learned in treating the disease and to identify opportunities ultimately for prevention and treatment during the pandemic. So I'm going to pause there, and I'm going to now introduce Dr. Jeffry Nestler. Dr. Nestler is the Chief of Gastroenterology at Hartford Hospital. He's also the President of Connecticut GI, which is a large gastroenterology practice spanning most of the state of Connecticut. And he's going to come forward and really talk about the importance of really getting back to all of us getting essential health care that we need that may well have been put aside as we've all struggled during the pandemic. Jeff?
Thank you.
Good morning. So I'm going to speak to digestive diseases and GI endoscopy. In mid-March, we halted all non-essential and elective GI procedures, including screening colonoscopy for colorectal cancer. Previous to that, we performed over 7,000 procedures per month across Hartford Healthcare. During the last several months, the number of procedures have gone down by 90%. So we're only performing 10% of our usual volume of procedures. Unfortunately, this led to two things. One is a 60% reduction of new GI cancers diagnosed during the same time period. And secondly, a number of our patients who've had chronic GI digestive disease issues have delayed diagnosis and delayed treatment because they did not come for their procedures or were afraid to come into our offices. The delay in diagnosis from having no cancer screening procedures could result in more advanced disease. As we all know, that if you catch the disease early and can take care of it, the prognosis, especially for colorectal cancer, is extremely good, over 90%. When it is diagnosed late, the 5-year survival falls down to 14 or 15%. The good news, and there is some good news here, over the last several weeks, we have restarted our procedures and our screening procedures, our elective procedures. We've performed over 1,000 procedures in our ambulatory surgery centers and another few hundred in our hospital units across Hartford Healthcare. To date, we do pre-testing, pre-procedure testing on all patients, and for the last several weeks, we've had 0 positive patients in the pre-procedure testing, which is great news. When you come into one of the units, we want to make a COVID-safe environment. So you come from your car with no visitors, you come right into the pre-procedure room. Everybody's wearing appropriate PPE. Everyone's keeping social distancing. You come into our procedure, again, everybody's wearing appropriate PPE. There is screening, symptom screening prior to coming into our unit, including temperature checks of not only patients, but also staff and providers every single day. So we're really trying to create a COVID-safe environment. You are then, after your procedure, you are discharged right to your car, your ride in your car outside the facility. So we are creating an extremely safe environment, and we have seen patients coming back, and we've diagnosed several cancers that would have been diagnosed several months ago. Luckily, the 2 I know about was still early on, but we strongly encourage people to come for the routine procedures, and also if they're having symptoms, to certainly call us, and we will be able to take care of the problem. So with that, I want to give this back to Keith. And we can answer any questions.
Thank you, Dr. Nestler. Any questions for myself, Dr. Orlando, or Dr. Nestler before we wrap up?
Hi, it's Lisa, News 8. I'd love to hear more about the clinical trials Dr. Orlando talked about.
Absolutely, Dr. Orlando.
Sure. So the one of the trials that we're very excited about is the clinical trial with a monoclonal antibody. This is an antibody designed in the laboratory that is targeted at the what's called the spike protein on the COVID virus. And so this is a phase 1 clinical trial that we will be initiating very soon. And again, there's a great deal of promise for that targeted approach. And it's really very similar to what would the convalescent plasma infusion, where again you're relying on antibody that has developed in a patient who has had the disease. In this case, this is laboratory-made antibody that can then be infused into the patients. There are several other pharmacologic agents that are also under evaluation. It's been interesting. Some of a number of drugs that are used to treat rheumatoid arthritis turn out to have the potential for activity in COVID-19. So some of those agents are also in the clinical trial process. The other interesting thing we've learned is through the analytic process, there are some old drugs, and one of them is a drug used to cut down on stomach acid. And it turns out that it might have some potential for utility in treatment of COVID. And so one of our groups of investigators has actually just submitted a publication demonstrating that. Obviously, this is early data that needs confirmation and eventually randomized prospective trials. But this is really using the database, examples of how we're leveraging our informatics and our database to make some of these early statements about what might be happening. Other questions about the research portfolio? Keith?
All right. Any other questions? No. No. So as I spoke about before in regards to our visitor restriction policy, right now we're in the phase 2 of the visitor restriction policy, and what to expect with that. So the overall process is visitors. It's a single visitor, one visitor per inpatient or per patient within the institution. There's age restriction, so no visitors under the age of 16. And the time period is a time period restriction as well. Again, all these processes are to ensure that our colleagues, our community, and our patients of most importance is kept safe. So in 1 hour, there's an initial screen, full questionnaire, and temperature check for all visitors that are coming in. Visitors should wear a certain level of PPE while they're in the hospital. That's an absolute expectation, to include at minimum a mask, and that will be provided if the visitor doesn't show up with a mask. So it's 1 hour, no visitors under the age of 16, and a single visitor per patient at this time. Any questions about that or anything that we've covered today? No. All right. Tina, any questions? Do we have any questions? All right, good. All right, thank you so much. Have a good day.